what are some obstacles you ran into? Like, because we've heard like a couple, but like, what was the big one for you where you're like, shit, but you managed to get over that?
Obstacles. Oh, I would say parents. I would 100% say parents.
Parents?
Really?
Yeah. Oh my God, some parents are so entitled, right? Like, it's fair enough because it's their child and they want the best for the child, but some parents are just so hard to deal with and they'll come at you as if you're supposed to know every single answer. Like, I'm just a student. I really don't know everything.
Hello, you're listening to the Sliders Podcast. I'm your host, Who's Taff. You're not finding out on the pod today. We have a special guest that you need to find out about, actually. And to my right, we have
Mo.
And our guest of the day today is Ivy Michako.
Hi, guys.
Now, Ivy is a second-year nursing student at Northumbria University. I believe your course is 3 years long, right?
Yeah, it is.
Okay, so starting off nursing, like, why pick nursing?
That's such like a broad question. Every time someone asks me, I'm just like,
Okay.
But mainly the typical stereotypical answers. I just love caring for people, especially children, and I've been brought up around loads and loads of children my whole entire life, and I've always taken under the role of like being the designated babysitter type of thing. And I know nursing and babysitting is a complete different thing, but just making a difference to people's lives, and some of the things that you encounter in nursing is just so like I don't want to say spectacular because that's kind of cringe, but it is, and it's always about making children smile and just trying to make a difference.
Then do you have a moment like that was spectacular? Like,
I think one thing that made me personally want to be a nurse that was a spectacular moment is when I went to hospital and I had to have a surgery, and it was an umbilical hernia, and just how the nurses dealt with me and looked after me, and my mum couldn't stay in the hospital with me for that period of time. I had to be in hospital for like a couple of days just to recover, and just how they were like, they always spoke to me if I was scared, if I didn't want to stay in the room by myself, they'd come and sit and talk to me and play games with me, watch TV with me. I just think that being able to do that and make a child feel so comfortable in like an unfamiliar environment is just really special. So
no, that's beautiful.
Yeah.
That's beautiful. How did you? There's not even any sense in asking how you found your course, because in a way your course found you.
Yeah,
sort
pretty
of.
much, yeah.
Yeah.
And to be fair, like I'm raised around a lot of nurses. Like my mum's a nurse, my aunties are nurses and stuff like that. So it's never been like an unfamiliar profession. So.
No, I have the same thing. Like
Yeah.
I have 3 aunties that are nurse. My mom's a nurse.
Yeah.
Like it's a Zim thing. I can't even lie to you. I can't even lie. It has to be a Zim thing. Like nursing is just one of those things that's sort of in the culture.
Yeah.
Like, damn near a cultural job.
Literally, yeah. Like if you say you want to be a nurse, they're not gonna be like, why? They're like, okay, cool, you do you.
I guess having family that do that course helps in a way.
Oh yeah,
So
yeah.
like, do you speak to them and ask them like, how do I maneuver the workspace afterwards?
All the time, constantly having conversations with my auntie. Just like when I'm in placement, sometimes I feel like I have to do a certain thing, like I need to be competent in so many different things, but like she always reassures me and says, if you don't feel comfortable doing something, just say, literally just say, like, and that's really reassuring, because sometimes you get ahead of yourself and you think, oh my god, I need to know how to draw up IVs, I need to do this, I need to do that, but in a sense you've got so much time to learn these things that you don't need to do it constantly. And I think that she always tries to tell me, like, don't rush, it's a learning process, and that's how you become a good nurse. Like, make sure you can do things properly.
Okay.
Yeah.
Now going back to university now, Northumbria University, like when you first walked in your first year, what were your first impressions of the course?
Oh, first impressions of the course. I don't know, like I didn't really know what to expect. But one thing I know that took me by surprise was how small the course was. I think altogether my cohort is like 80 people.
80?
Yeah.
I would have expected more.
Yeah,
Yeah.
it is, yeah. And typically child nursing, like, they don't take that many people on, but it is a small cohort. And I'm the only black person in my whole cohort.
Damn, that was the next question, demographics.
Yeah, no, I'm the only black person in my whole cohort. So I used to feel so much pressure in like having to do things right and like, do you know, like the little things like not being late because you're the black person, they're going to be like, she's black, she's late. But it's not like that.
Are you the only minority, period?
Yeah, well, there's a Polish woman.
Okay.
But yeah, I guess so, yeah.
All right.
Damn.
So let me ask this then. So with your course, when you went in, like, how did you handle that? Like during that year of that pressure of being black, like how did you?
I think I just got on with it, to be fair. I didn't let it faze me too much. I know there was times, like I just said, like feeling like you're the outcast and wanting to behave in a certain way so that people don't look at you some type of way. But I just got on with it. I just made friends and just got on.
Okay.
Yeah.
You mentioned that you went into pediatrics. So at first I thought nursing was one of those courses that you go in and you're with everyone that does nursing, then they separate you off into adult, mental health. But so do you go into pediatrics straight?
So one of my friends in Birmingham actually did what you're talking about. So it's not necessarily a foundation yet as such, but you get to see the whole scope of nursing. So you get to try out all the different nursings, and then you get to pick in your second year what stream of nursing you want to go into.
Okay.
But for me, that wasn't the case. I just went straight into child nursing.
And would you say that you went straight into child nursing because you already knew that you had a particular fondness for children?
Yeah.
So you didn't really need that year before where you could look at everything else that nursing had to offer?
Oh, yeah. Like, I'm so not interested in, like, doing adult nursing at all. Like, I don't even care to have, like, a placement or anything like that because it's just not something that interests me. So it'd just be wasting time, I think.
That's fair enough.
True. So take us back to just before entering uni now. Your personal statement, you're writing it. What type of things are you putting in there to really sell yourself for this course?
Yeah.
So in my personal statement, I think I had such a hard time with this because I wanted to, like you said, sell myself as much as I could because I know it's a small, like they take only a small amount of people in. But I've done like a lot of different things, so I didn't know what to include. Like, I didn't know if I should include my hobbies, like dancing, because I used to dance for a long time.
What type of dancing?
I did contemporary.
What does that mean?
It's like lyrical, but not lyrical.
Lyrical dancing?
Yeah, but just not. Like, I don't even know how to explain it. Like, you wouldn't use anything like with actual lyrics. It's more like
Sounds.
Yeah.
Oh, okay. Oh, instrumentals.
Yeah,
okay.
that's it. Instrumentals.
Oh,
yeah.
okay.
Oh, okay.
Yeah. And with dancing, like, it took me everywhere. I went to Wembley. I performed twice there, which was really cool. I did loads of different things with my dancing, like performed in my local city hall and just stuff like that. So I didn't know if I should include all those things or if I should include what I've done, like, to back what I'm doing for nursing. So I did a placement in sixth form at my local hospital, and that was really cool. So I included stuff like that. And then one thing I really wanted to make sure I mentioned was the fact that I was ambassador for my school and sixth form, and I went to Portugal to represent my school. And yeah, I did this thing called Bridge to Employment, and it was a three-year course type of thing, and this started in year 11, I'm pretty sure. Year 11 type thing, and they followed us all the way through sixth form, and it was just a series of like how to develop yourself as an employee, as a student, and all those different types of things. Yeah. Okay,
so like nursing, fun fact about nursing actually, I don't know how accurate this is, but it's top 3 most popular university courses.
Oh, is it?
Yeah. So like a lot of unis offer nursing. So how come you picked Northumbria? Like, why North?
To be fair, I just wanted to get away from home.
Oh, and where's home?
In Leeds. I did want to move away from home and stuff, and I didn't want to move somewhere that was too far. Like, you can easily get on the train. It's only a 1 hour 45-minute train ride. So, but then once I actually came to my interview here, I just fell in love with the place because it gives the same vibe as Leeds. Like, it's small. Everyone kind of knows each other, like the proximity wise, it's quite comforting. Yeah. So really liked that, and I really liked the campus too. Like, the whole clinical building and stuff, it's got loads of different facilities that you can use, which is really cool. So yeah.
Okay, lovely stuff. What's the long-term goal?
Long term.
Yeah, we're talking uni's done, 5 years from now, like, what is it? Is it agency thing?
Ideally,
Yeah.
I would have said that I'd like to work abroad. So I was looking into it kind of. And my degree is transferable to Australia.
Yep.
And in Australia, the pay is double what you get here. So I'd like, in terms of like getting my money up, I'd like to do that. But if that isn't a possibility, then I'd stay and work in the NHS. I think after I qualify, this is not set in stone, but after I qualify, I'd probably stay in Newcastle, just because I'm so familiar with the hospitals here and working here that I'd like to really, like solidify my skills and everything like that. And eventually I want to specialise and then work privately.
Okay, what we're specialising into?
That I still haven't figured out yet.
Okay, tune in on the next time when we get Ivy here when she's specialised, then she can talk on that too.
Yeah.
But damn, like everyone talks about Australia. Like every nurse I know goes off to Australia.
Well, I'd like to go to Dubai, but I don't know if the course is transferable there. So.
Okay, but it's one of those things that every country has a nurse.
Yeah,
like, So you're never out the job, as they say, and you can go anywhere in the world.
Literally,
which is a pretty good thing to have.
Are you jumping straight into the job after you finish your course here at uni?
I think so, yeah.
Oh, damn.
Do they take nurses on easily? Like, how's the job market in terms of competition?
No, I think it's so easy to get a job, like, especially when you've been on placement. Like, say, for example, a lot of people usually tend to get a job where they've had their management placement. So your management placement is your placement that you get at the end of your course. And usually it's where you take on the actual role of a nurse. So you just feel so nursey and like, and you're doing other things like handing over, having your own patients and doing the shifts for other nurses and all this stuff. And then your tutor comes to assess you and stuff like that. And usually people do their, get a job on that placement, yeah? Or to be fair, if you're applying everywhere, like every hospital, every city needs a nurse. So it's not, I don't think it's like a competitive like place, but different wards are competitive. So,
okay. So what do you mean like different wards?
So I feel like PICU, I feel like that's
what's
that? Pediatric intensive care units.
Okay.
I feel like those are quite hard to get onto, just because you're dealing with really, really sick patients and stuff. So you've really got to know your stuff, and everyone kind of wants to work on that because it's really, really nice. I wouldn't say nice as such, but like that's where you feel like you're making a difference because of how sick the children are.
So it's rewarding in that sense.
Exactly. Yeah, rewarding.
The sicker the children, the better the difference.
Yeah,
pretty
much.
That sounds terrible. Okay.
But now just the studying side of things, because nursing does put you in the field like pretty early. But in terms of studying and examination, how do you do that? Like, how do you study?
Oh, Chile. Studying is.
Hey, we can relate. A moment of silence.
It's been kicking my ass. Like the studies, I personally feel like what you learn in your studies has nothing to do with what you're doing on placement. Like take out like all your clinical skills stuff and like all the practicals and stuff like that. It just doesn't relate. Like some of the stuff I'm doing in my assignment, I just think, why am I even talking about this?
Hey, talk on that. What's this assignment about? Let's.
So, oh God, this is gonna be bad because I can't even remember.
Jesus.
That's how bad it's kicking me. But some of the stuff, like we have to critically discuss certain points of nursing, and fair enough, like that's really important to understand what nursing is and all this stuff. But I just sometimes feel like, damn, like why am I really talking about these things? Like, and I don't know if maybe it's because I'm more of a practical person than I am. Like, I just don't really like the whole assignments thing. But I personally think it would be better if my course assessed us in different ways. So not just assignments and have tests and stuff as well. But yeah, I just think it's hard. It's really hard.
So they don't test you in any way to do with your placements?
Not in any way to do with my placements, but we do have a test. I'm pretty sure we have 2 in 3rd year, and those will be the only tests that I will have done in my course. And the tests are on medicine management, and you've got to get 100%.
100%.
Yeah, because if you can't do medicine management, then it's like you can risk a patient's life. Do you know what I mean? So you've got to get 100%.
But anybody can make a mistake.
Yeah.
Like 100%. It's crazy.
100% is crazy.
To be fair though, to put it in perspective, it's 100% for the medicine management part, and then the other part is a scenario part. So if you don't get the scenarios part, it's not as important. But you have to get the medicine part 100%. Yeah.
So what's the layout of this 100% now? Because this is deep. So what, like 10 different medicines you manage, or?
I think it's a series of like 5 different medicine management scenario questions, and then the last one is about IVs, calculating IVs, and it'll ask you like how you draw them up and just the process and steps to doing it. I think, I'm not too sure, so don't quote me on that.
And have you ever done that yet on your placement, like place an IV in?
So I've been taught how to do it on placement and stuff like that. I haven't done it completely by myself and independently yet, but everything else, such as drawing up medicines, like common medicines, I do that. So yeah.
Would you say that was a daunting task when you did it, or
100%.
with help for the first time?
Oh, 100%. Like, I think anyone can say that drawing up medicines for the first time is really scary, because you're under the pressure of your mentor watching you and then you trying to do it right. So I think the first ever time I was drawing up just a normal medicine, I can't even remember what it was, but I was like this. shaking, and I kept on missing the bottle, and then my mentor looked at me and she was just like, "Are you okay?" And I was like, "Oh, yep, I'm fine." And all I needed to draw up was 5 mils, and it was just taking me so long because I was just so scared. But yeah,
it sounds intense though when you're talking about it. You need to get 100%.
Yeah.
I don't know how many courses demand that of their students. To be fair,
that field of like the hospital in general isn't a hit or miss place. You mess up and someone's life is on the line.
Oh yeah.
True. You can't have a few bad apples in the hospital.
That's facts.
Not one bit.
It's hard for students. Like, I feel like sometimes you let the pressure get onto you so much, like you don't want to make a mistake, and sometimes you forget that you're only human, so you are bound to make a mistake in some way or somehow. Like, obviously you've got the major mistakes that that can be taken on the board or whatever, I don't know. But you are only human. If you make a mistake, it's fine. Like, it's okay. And just to reflect on that mistake and hopefully not do it again.
Okay. Yeah. So going back to Northumbria again, like, what are some of the facilities the uni offers? Because you mentioned it had good facilities for helping you guys out.
Yeah. So, like, obviously we have a clinical skills centre, and that's just got everything. Like, it's made to look like an actual hospital, and you can access that before COVID you can access that at any time. I remember at one point I was really struggling with doing manual BPs, so I used to always go there with my friends, and like they've got like the mannequins. You can't call them dummies anymore, don't know why, but
that's interesting.
No way.
Yeah, you can't do that. So the mannequins.
So what, mannequins or dummies have rights now?
Apparently so. Everyone's got rights now. So yeah. I used to always practice on them, and like they have like they're built so that they have a pulse and stuff like that, so you can check it, and it's really cool.
Weird.
Yeah, it's really cool. And like you've got babies in different scenarios. We've got like baby mannequins that can move, and you can change their heart rates and all this different stuff, and I think it's really cool.
That's great. I didn't know they have robots and shit.
Oh yeah. Sometimes you walk in and you'll see like a clinical bed and like a full-on mannequin in the bed, and you'd be like, whoa, like, could you forget?
That's not real.
Yeah, I would hate to be alone at night in that case, fam. Moving mannequins with pulses. Yo.
But what's a manual BP? Does that not involve using like the machine that you put around your arm? Or?
So yeah, usually, and this is, I think it's just in nursing training that everyone has to get taught how to do a manual blood pressure, and usually, if you go to your GP and they say, "Oh, I'm going to take your blood pressure," they usually just put the cuff on and it's a
Yeah.
machine that does it for you.
Right.
But we have to do it with stethoscopes and the BP cuff, and you've got to like dial it to get the systolic, and then dial it back down after you're pumping it to get the diastolic.
Yeah. No, those are the right ones. Yeah.
Yeah, and you use the stethoscope to put it underneath the cuff
Right.
and to check the pulses, basically. Yeah.
Okay, that's some technical stuff. What are some obstacles you ran into? Like, because we've heard like a couple, but like, what was the big one for you where you're like, shit, but you managed to get over that?
Obstacles. Oh, I would say parents. I would 100% say parents.
Parents?
Yeah. Oh my God, some parents are so entitled, right? Like, it's fair enough because it's their child and they want the best for the child, but some parents are just so hard to deal with, and they'll come at you as if you're supposed to know every single answer. Like, I'm just a student. I really don't know everything.
Are they aware that you're a student though?
Oh yeah.
Oh, you gotta check because sometimes.
My uniform is very distinct. It says student nurse. It says Northumbria University. And most of the time you can tell we're students because like we're just so like scared.
True.
We're full of anxiety, and they'll ask us questions like, or they'll be really angry at you, and it's like, why are you angry at me? Like, I didn't put this on your child. I'm just here to help. So some parents you come across are just so like evil, like really.
Wait, do you mean your parents or the
parents at like a placement?
Parents on placement, like the children's parents.
Oh,
those are the obstacles.
I thought you meant your parents.
Oh,
I was
no,
like,
no,
so
no.
you come home and they're like, quick, dad's on the floor. What do you do? You have to quickly figure it out.
No. I mean the parents on the wards.
Okay.
Yeah. You get some really challenging parents, and parents that will swear and kick off and just all these different things, and you're just like, that's none of my business.
And how do you deal with it then?
Yeah.
I think how I personally deal with it is always just saying, if you have any other issues or if you have any other queries, just ask me and I'll relay it back to my mentor. I'm just here to do a certain job, for example. So if I'm doing observations, I'm just here to do observation, but I'll make sure that that question is passed along. Or I'll just say, I'm really sorry that you feel this way. Just trying to be as polite as I can, even though like they might be rattling me, really pushing my buttons. Just trying to stay like as calm as possible, and just not, after I've passed it on to my mentor or the ward sister, whoever's working, I know it's not my problem anymore. Like, I shouldn't take it to heart as well. Like, some people are just the way they are because that's how they've been brought up. Yeah.
Or even the pressure, because like you said, you're working with their children.
Yeah.
Child's life might be at balance here.
Yeah.
But that's one thing about nurses, the patience that nurses have in those scenarios, where each day, like, someone's cussing you out, shouting, or even days where things don't go well in the ward. Like,
I've had I've seen whilst I've been on placement, nurses run to the staff room because they're just so upset they've been made to cry by other parents, and it's just so it's unfortunate because you can tell like someone loves their job so much and they're putting their all into it, and this is what's getting thrown back in their face. It's just really sad sometimes. So you're right about the patience thing. You have to have so much patience.
Damn. But overall, you're happy with the facilities your uni gives you?
Yeah. I think quite good, yeah.
Okay. What about lecturers?
I think with nursing, you can, especially child nursing, I don't really think there's any horrible lecturers. Everyone's just so accessible. Everyone's really lovely, and they're all nurses themselves. Okay. So a lot of my lecturers have been on the wards. So whatever they're talking about, they've experienced it. They know their stuff. Okay. So it's easy to relate to them. It's not just someone trying to teach you something and they've never experienced it before. So I think it's really nice in that sense. Yeah.
And in terms of response times, have you ever spoken to your lecturers about any issues you've had or help you've needed?
Let's not talk about that one because, there's a long ass list. There's some lecturers, I think it's I don't know if it's a uni thing or what, because everyone seems to have that same issue that you'll send a message or you've got something to say to your lecturer and they don't reply. We had that coming into second year, and my tutor just didn't reply to any of our questions ever. Though she's good, she just never ever used to reply to
What's
us.
her name?
Are you trying to get me into trouble or something?
Jeez.
Yeah. In terms of that, I think it's the same as everybody else. To be fair, we still have the same struggles as you guys. So yeah.
That's right enough.
But yeah, overall, the quality of your examination, lectures, and facilities, you're happy with it.
Yeah, I think I am really happy with it. Like, obviously, like I said, assignments can be hard, but that goes with anything. Like, sometimes you can find things really difficult, and yeah,
Wait,
it is what it is.
talk on that. So, like, the difficult assignments, what were the most difficult assignments, and what was the easiest assignment that you've done?
So far, I'd say the most difficult assignment that I've had to do so far was the one I've just done about the critically discussed thing, because I feel like they could have just gone into more detail on what that actually consists of, and they focused on, for example, in a lot of nursing assignments, you have to have a scenario, you have to have a patient and what this patient's going through, and you usually get lost and get into, I'm someone personally who goes off on a tangent a little bit, so I'll start talking about my diagnosis, my patient, their home style, and all these different things, and then when it's time to critically discuss or analyse, it's a bit difficult because you're like, wait, what am I critically discussing again? It's not specific. So yeah, I just think I found that a bit difficult. And in terms of support, not to say that my tutors didn't support me, but they didn't support me.
Or it was just you on your solos?
No, a lot of people felt the same way.
Yeah.
Like, I feel like sometimes it's, here's their assignment, go do it.
Okay.
Yeah,
The group
so-
chat must have been going mad.
Oh yeah,
I know when
no.
there's a shit lecturer in the group chat.
Oh no, yeah, it was going crazy, and it's the like added anxiety, of other people not knowing what to do. So none of us know what to do. So
Yeah.
who am I going to turn to?
Yeah.
But there's also comfort in that, because
Yeah,
that
true.
means you can all unionize and go to this lecturer and chat to them properly about
Yeah,
what
it's
they're
true.
doing.
But
Are there any like external like sources you can go to for help in those kind of situations, like
To
your
be fair,
parents or?
usually, well, not necessarily external, but usually what I do is I just go to other lecturers.
Just other lecturers? Oh, okay.
I just usually just go to the lecturers and I email them and I say, hey Claire, I'm really struggling. Can you please just break this down for me? And usually it helps. Or like, you go to like the ask for help thing and go on the IT thing and just look at different articles, do further reading maybe,
Okay.
and just, yeah.
Is there specific websites that you use for nursing to assist you, or any specific tools that help you?
Not at the moment, no, but
Okay.
I find comfort in reading, like, about nursing things. So right now I'm reading the It's Going to Hurt book by Adam Case, I'm sure. If it's not, sorry guys.
No problem.
But I find comfort in reading stuff like that because it tells you so many different things about the nursing world, and that way you can kind of gauge the terminology used, the language used, and then I can implement that in my assignments. Even though it might not relate, it might be a story about something completely different, but I just know the terminology, I know the kind of language to use, and I feel like that's what they're kind of looking for in assignments sometimes.
Yeah.
Yeah.
But doing your course, you're 2 years in now. How has your course affected your mental health in terms like, has the stress really piled on? Like, and at what point was that during the course?
Ooh, mental health talk.
Mm-mm.
So there was one point and this was, I think, just before COVID got really serious, and it really took a toll on my mental health because I'm an anxious person already. I think a lot of people just know that 'cause I'm always anxious, but like I was so anxious that I'm not gonna have completed my PAD, which is our placement assessment document, and you've got to complete different competencies to say that you've passed this one placement.
Yeah.
So I was so worried that, because I was a first year student before coming in, I'm going to get pulled off this placement, I'm not going to have completed my pad, I'm going to have to repeat the year or something like that. And do you know when people say, oh, first year doesn't count? In nursing, that's not really a thing.
True.
Because
Okay.
you've got placements, you've got to get things signed off.
Yeah.
So I was just so worried, but I forgot that everyone else is in the same boat, and like we did not have any control of what was going on. So it became clear to me that obviously everyone else is in the same boat, I don't need to worry about it. But there has been other times where I've just felt so like overwhelmed and physically drained, because the shifts are so long, they do really impact you. Like your friends, I might have a shift on Sunday, like that might be a long day, and all my friends want to go out on Saturday and they want to drink and stuff, and I have to prioritize the fact that I've got the shift on Sunday. Like I can't just stay out all night and do whatever I want, because I'm going to be waking up at 6:30 hating my life, like really struggling. So this, in terms of stuff like that, you do have to be really mindful of what you do. I mean, there has been times where I've kind of pushed it a bit and still gone out and then regretted it in the morning.
Yeah.
But yeah, it does take a toll on your mental health, and especially when other people are comparing what they're doing on placement. So I think when people are saying, oh my God, I've just had my own patients today and I drew up all these IVs and I did this and I did that, and I don't know, like all these different things that you can do, you might feel behind, and then you might feel like you constantly need to catch up. Whereas, like I said before, everything is a process and you've got to do it in your own time once you get the opportunity. And also looking for opportunity as well is really important. But yeah, it's hard, but you have to just remember that you're doing it because you love it and not because you're being forced to do it. So yeah.
True. Do you have any advice for people that are thinking of taking the course?
Yeah.
I think if you're thinking about taking the course, then you should definitely do it. It's a lovely course to do, and it's the most rewarding thing ever. Like once you're actually on placement on the ward, you wouldn't change it for the ward. Like once, it sounds really like cringe and stuff like that and cliche, but once I'm actually on the ward, even though like I didn't want to wake up that whole entire time, I think, oh my God, this is why I want to be a nurse. Or when you see other people, like other nurses working, you're just like, oh my gosh, this is why I want to be a nurse. And it's just really good. And there's always going to be like a need for nurses, so it's good in terms of like getting a job straight away and everything like that.
Okay.
Yeah.
Now, nearing the end, what are some of the life lessons universities taught you so far? Just your overall experience, what have you learned?
My overall experience of university has just definitely taught me just to be more independent. I am such a mummy's girl, not in the sense that she does everything for me, but any slight issue that happens in my life, I call my mum. I'm like, Mum, this has happened. Mum, they don't have white bread in Asda. Like I'm always calling my mum, like all the time. But it's taught me to deal with things by myself. And I remember when my first ever time going to placement, I woke up late. And I cried and cried and cried and cried. My whole way there, I cried. And my mum was like, why are you crying? Like, stuff like this happens. You're not going to make the same mistake. You was probably up because you were so anxious. But you don't need to cry. And I think what Eunice taught me...
Were you anxious the night before?
Oh, yeah, so anxious. But what being at Eunice taught me is to take things in my stride and just to get on with life. Like, it's not the end of the world if you make a mistake. It's not the end of the world if you can't figure something out, because there's always a way, do you know what I mean?
Yeah.
And just making friends as well. Like, I found it so easy to just make friends. Like, I just talk to random people because you're kind of forced to. Like, you're in this city by yourself where you don't know anyone. So you're forced to make friends, and I think that's a nice thing that Eunice taught me, just to talk to strangers. And okay, not all strangers.
Stranger danger.
But yeah, just making friends with people and being really friendly and stuff like that, yeah.
Okay. And what do you feel like you've learned specifically from your course that you'll take on with you as you move on in life?
Just to be compassionate. It's hard to know what someone's going through when they don't tell you, but just to be there for them. So sometimes people don't necessarily want to say, okay, I'm struggling with such and such. It could be mental health, it could be a biological thing, but just to say that you've been there for them and say, okay, I'm with you, or okay, I understand. and just stuff like that. That's really that's a big life lesson it's taught me, and that you don't need to always have an explanation for things. Like some people feel some type of way, and just to say that you've contributed to them feeling much more happier is a nice thing, nice feeling.
Okay. Mo, any questions before we ask the final few?
I want to know if there's any like common misconceptions about nursing that you heard of before you came to uni, that have been cleared up now that you've actually started the course and like you're halfway through it at this point.
Common misconceptions. That you'll be wiping bums a lot.
At least it's children.
Good way.
That's not necessarily always the case.
Oh.
And that is like an easy job too. Like I think some people like think that nursing is really easy, but mentally, physically, emotionally it's draining. Like it's a full on the clock job. Like anything can happen, and I think sometimes you feel like, I used to think like work is work. You go to work and then you go home and that's fine. But with nursing, sometimes you take work home. Like I'm constantly thinking about the patients I've dealt with that day, or if they're gonna get better. Like you don't stop thinking about it. So I think in that sense, that was a misconception that you'll just be able to clock off and continue with life, because that's not the case. I'm not sure if there's any more.
That's fair. And you're on how many shifts a week right now?
I'm currently doing 3 shifts a week, but it can vary.
It can vary. Yeah. So when you actually step into the job for real, is it going to be a similar number? Like it varies week to week?
Yeah. So usually nurses do 3 to 4 shifts a week, and those are 12-hour shifts. Yeah. But you can pick up shifts if you're doing overtime.
Wait, do you get paid?
Child, not this again. No.
Oh.
It's really upsetting, and I don't want to talk about it because I'll cry.
Yeah,
that doesn't make any sense.
Like a little bonus question, like, what's your take on the recent NHS thing?
Yeah, there was a 1% pay increase for all NHS
that
workers.
Is so degrading.
Yeah.
I think it's absolutely outrageous, and I'm so right. Like for like all the nurses to feel like underappreciated. Like, why do they constantly think that giving these people a clap is anything of substance? Because it's not. And loads of nurses will say that, like, when I'm sitting in the staff room, minding my own business, they'll constantly talk about how underappreciated they feel by the government. Yet the government are the same people that always talk about, the NHS, this, we love the NHS, support the NHS. But they're not supporting the NHS. They're not supporting the people that work for the NHS. And I think it's so upsetting, like, because the stuff that they do, the work that they put in is immense compared to what they're getting paid. It's ridiculous.
It's upsetting me and my nurses.
It's upsetting me and my nurses. It is.
And finally, wins, losses, and lessons. What were the wins of your course, some losses, and the lessons you've learned?
The wins. I've had a few wins. Like, so when in my current placement, the first time I scrubbed for one of the surgeons, that was a big win for me, because I felt this is so out of my comfort zone. I'm not in a ward, I'm in a theatre, and I've never had to deal with instruments before, and that was a big win for me, because I just thought I learned so much from it, and it was just cool being in a different area of nursing. And when one more win from the ward was when I was looking after a child who had asthma, and she had her first ever panic attack, and I was able to control her breathing and just calm her down. And her mum was so she was so amazed, because she didn't know what panic attacks were. And then after that, I'd explained to her, like, I used to have panic attacks as a child all the time. And one exercise I always like to tell people is just close your eyes and take a deep breath in. And imagine you're on a beach, and when the water comes in, you breathe in, and when the water comes out, like goes back to shore, you breathe out. And she did all of that, and by the time my mentor had come, her breathing was completely controlled. And it was just a nice feeling to know that I've been in that situation before, and I'm now relaying my techniques to somebody else and actually helping them.
Yeah, that's beautiful.
Yeah, that's really nice. Losses. I think having to struggle mentally, like getting up and just constantly having to remind myself why I want to do this, because it is really hard, and like I have to I can't just put everything into placement, because I think you guys can tell I really like placement, and then I really don't like the academic side. You've got to, like, sometimes you've got to really crack on and just put more time in both things, like manage your time better, I guess, and sacrifice maybe going out and just all those kind of things. So I guess that's kind of a loss in a sense. And lessons just, if you're an evaluative person, it'll really help. If you can self-evaluate, it'll really, really help in your journey as a nurse. You'll be able to pinpoint, okay, I did this well, I'm going to continue doing that. I didn't do this so well, so maybe I'll learn from this and change that. And I think that's a really nice thing, especially when working with children. It's not a one-size-fits-all profession. You've got to know how to deal with different people and different temperaments. And yeah, so long as you know that you're not always going to make somebody happy, and that's fine. Some people are not going to like you. That's also okay, but just evaluate.
Okay.
Yeah.
Thank you so much for being here.
Thank you for having me.
It's been great.
Yeah, it's been great. This has been Sliders Podcast. I've been your host, Who's Tav, and you found out about Ivy Machaka today. And we had
Mo.
Goodbye, people. And since you're still here, the Patreon, Sliders Miami, and we've recently added Tokyo and Venice? Monaco, yeah. So if you're still at the end, that means you like us that much that you watch the full video. So please take yourself down to the Patreon, donate what you can. Everything's appreciated, and thank you.
Yeah, make sure to like, comment, and subscribe. Also check out Ivy's YouTube channel.
Yup.
Yeah, you know, we're avid watchers.
TikTok and that.
But yeah, Ivy's Instagram will be in the description below, so you can hit her up there. If you have any particular questions that you want to go into further with her, I'm sure she'd be happy to answer. So yeah, thanks for watching and sliding out.